Omicron is here. What now? Your questions on COVID-19 answered by Dr. Lancelot Pinto. First question: how accurate is rapid antigen test? Dr. Pinto says, rapid tests have a high specificity, making false positive results unlikely. A positive is usually a true positive. If you have symptoms and the rapid antigen is negative, you should confirm with an RT-PCR. A negative rapid antigen test does not mean you don't have COVID. Rapid antigen tests can miss up to half of all COVID infections. Second question: should I be worried if I cannot get an immediate appointment for a test? Dr. Pinto says, an early test result would be important only for high-risk unvaccinated individuals who may need an antiviral drug. If you do not fit this criterion, take the available slot and wait. You must isolate until you get the result, as you are very likely to spread the infection at this stage. If you are high risk and unvaccinated, do a rapid antigen test. Third question: my kid has symptoms. How do I approach this? Dr. Pinto says, if someone at home is already infected, assume your child is infected too. Testing is useful, as it will have implications for isolation. If nobody at home is infected and your child has symptoms, it would be wise to limit the child's movement to a well-ventilated room, and have everyone entering the room wear an N95 and sanitize their hands. It is very likely, given the transmissibility of the present strain, that others will be infected, and they should test 5 days after the child has symptoms or when they develop symptoms. Children normally have mild symptoms, lasting 2 to 3 days, similar to the usual colds, fevers. Contact your pediatrician. Do not panic if you do not get an immediate appointment. Begin symptomatic treatment, e.g. paracetamol for fever, which you would normally do for a routine viral respiratory infection. If your child has underlying medical conditions, seek your pediatrician's advice. Fourth question: I have had contact with someone who I now know was infected. When should I test? Dr. Pinto says, if you have symptoms, test right away. If you don't have symptoms, wait for 5 days after the contact occurred and then test. Quarantine until you test. If symptoms occur sooner, then test right away. Fifth question: can I know from the test if this is Omicron? Dr. Pinto says, it is likely that most infections in the present surge are caused by the Omicron variant. S-gene dropout on the RT-PCR is highly likely to be Omicron. Not all labs use the S-gene to test, though. The presence of the S-gene, however, does not mean that this is not Omicron. Casirivimab and Imdevimab or Bamlanivimab and Etesvimab, Eli Lilly, do not work against the Omicron.